Imagine this scenario. Your spouse or loved one has a sudden medical emergency, maybe severe chest pain, a bad fall at home, or a scary spike in blood pressure. You rush them to the emergency room. After hours of tests and waiting, the doctor walks into the room and says, "We're going to move them to a room upstairs for a couple of days so you can keep a close eye on them." You breathe a huge sigh of relief. They're in a real hospital bed, wearing a gown, hooked up to monitors, receiving IV medications, and being cared for by nurses around the clock. You naturally assume they've been admitted to the hospital as a patient. 3 days later, they're feeling better and discharged home. The physical therapist recommends 2 weeks of rehabilitation at a skilled nursing facility to make sure they recover safely. 2 weeks later, a bill arrives in your mailbox for $8,000, $10,000, or even more. Why? Because despite sleeping in a hospital bed for 3 straight midnights, they were never actually admitted to the hospital.
Welcome to the Medical Walkthrough.
Your loved ones were placed under what Medicare calls observation status. On paper, as far as Medicare and the hospital's billing department are concerned, your loved one was just an outpatient, the exact same legal classification as someone who walked into a clinic for a 15-minute routine x-ray. This single billing distinction is one of the most financially dangerous traps in healthcare for adults aged 65 and older. It can wipe out savings, block access to Medicare, covered rehabilitation care, and leave you holding the bill for thousands of dollars in surprise daily medication fees. In today's video, we're pulling back the curtain on observation status versus inpatient admission. We'll look at why hospitals do this, how it completely alters your Medicare coverage under Part A and Part B, the devastating 3-day rehab trap, and most importantly, the exact steps you can take to fight back and protect your family's finances. Now, before we jump into how all of this works, if you appreciate straightforward, honest advice that helps you navigate healthcare without getting blindsided, please take a quick second to hit that like button and subscribe to the channel. Healthcare rules are tricky and change constantly. Our entire mission here is to equip seniors and family caregivers with the exact knowledge you need to save money and get the care you deserve. Clicking subscribe helps more people find these critical warnings. Thank you so much for your support. Let's get right to the root of the problem. What is actually happening when you or a family member are sitting in that hospital bed? To the naked eye, inpatient and observation look identical. You're in the same building, wearing the same hospital gown, lying in the same bed, eating the same tray food, and being seen by the same nurses and specialists. But in the eyes of Medicare and your health insurance, they are two completely separate financial worlds. What is inpatient admission? An inpatient admission means a doctor formally writes a medical order admitting you into the hospital. This happens when your medical condition is severe enough that it requires intensive, complex hospital care that cannot safely be done in an outpatient setting. When you're formally an inpatient, your care is covered under Medicare Part A, hospital insurance. Under Part A, you pay a standard one-time deductible for the entire benefit period. Once that deductible is met, Medicare covers almost all of your hospital expenses for up to 60 days, including your room, round-the-clock nursing care, lab work, surgeries, and all medications given to you while in the hospital. Observation status, on the other hand, is officially classified as an outpatient service. Hospitals use observation care when they aren't sure if a patient is sick enough to be admitted as an inpatient, but isn't well enough to safely be sent home. They're holding you to observe your condition and make a decision. Because observation status is billed as outpatient care, it falls under Medicare Part B, not Part A. That subtle distinction changes your entire financial picture. Under Part B, you're responsible for paying a 20% copay or coinsurance for every individual service, lab test, blood test, and scan performed in the hospital after meeting your Part B deductible. This is one thing that catches almost everyone by surprise. And it's about your medications. Hospital pharmacies charge high retail rates for routine daily medications like your standard blood pressure pill, cholesterol, or diabetes pills. Because Part B does not cover routine self-administered medications, Medicare won't pay for them. Your Part D prescription drug plan might also treat them as out-of-network, leaving you with a $40 or $50 bill for a single daily pill. You might be asking, if a patient is staying overnight in a bed, why don't doctors just formally admit them? Well, it comes down to government audits and the Medicare 2 midnight rule. Under federal guidelines, a doctor should only write an inpatient admission order if they expect the patient to require hospital care that spans across at least 2 midnights. If a hospital admits someone as an inpatient and Medicare later audits the file and decides the patient wasn't sick enough to justify 2 midnights, Medicare reclaims the entire payment from the hospital and hits them with penalties. To protect themselves from losing money, hospitals play it safe and assign patients to observation status, effectively pushing all the financial risk onto you. Trying to remember all these complex rules while you're sitting in a noisy hospital room with a sick family member is impossible. That's why I compiled everything you need into a clear step-by-step guide called the Patient Protection Blueprint. This ebook gives you a simple hospital action plan, a checklist which gives you the exact questions to ask the attending doctor, a script to challenge observation status on the spot, and appeal templates you can use right away. You can grab your copy right now by clicking the link in the top pinned comment or in the description below. Keep a copy on your phone or print it in your glove box. It's your personal defense manual against surprise hospital bills. Now let's talk about the single most costly consequence of observation status, the skilled nursing facility trap. Many older adults who go to the hospital, whether it's due to a bad fall, pneumonia, stroke, or post-surgery complications, aren't ready to go straight home after leaving the hospital. They need short-term rehabilitation at a skilled nursing facility or an SNF to do physical therapy, regain mobility, or receive professional wound care. Here is the federal Medicare rule you must memorize. Medicare Part A will only pay for a skilled nursing facility stay if you have a qualifying inpatient hospital stay. What counts as a qualifying stay? You must be formally admitted as an inpatient for at least 3 consecutive days, 72 hours, not counting your day of discharge. If you spend 3 nights or even 5 nights in a hospital room under observation status, 0 of those days count towards that 3-day requirement. Let's walk through how this impacts real people every single day. Take Mary, a 79-year-old woman who slipped and fractured her hip. Her daughter rushed her to the emergency room on Monday, let's say Monday evening. The hospital placed Mary in a hospital upstairs to manage her pain, run tests, and monitor her stability. Mary stayed in the hospital room Monday night, Tuesday night, and Wednesday night. On Thursday morning, the hospital physical therapist evaluated Mary and determined she couldn't walk safely on her own yet. They recommended 14 days of inpatient rehabilitation at a local nursing facility. Mary's daughter felt relieved knowing that Medicare Part A covers up to 100 days of skilled nursing care after a hospital stay. So Mary was transferred to the rehab center and completed her 14 days of physical therapy. A month later, Mary's daughter opened the mail to find a bill from the nursing facility for $13,500. When she called Medicare in a panic, she learned a devastating truth. Mary's 3 nights in the hospital room were classified as observation status. Because she lacked 3 consecutive inpatient midnights, Medicare legally could not pay a single dollar for her rehabilitation stay. This happens to tens of thousands of seniors every year, but once you understand the system, you can protect yourself. So how do you prevent this from happening to you or your loved ones? It starts with knowing your rights under federal law. Because so many seniors were getting hit with surprise bills after observation stays, Congress passed a law called the Notice Act. Under this rule, hospitals are legally required to give you a specific written form called the MOON, Medicare Outpatient Observation Notice. If you are placed under observation status for more than 24 hours, the hospital must deliver this notice to you within 36 hours of observation starting. It must explain in plain language why you are in observation status instead of inpatient status. It must explicitly detail how this affects your copays and your coverage for post-hospital nursing care. Warning: do not just sign this paper and hand it back. Receiving a MOON notice is your official red alert. The moment that paper enters your hands, it's time to take action while you are still in the building. You do not have to accept observation status passively. Here is your step-by-step game plan while still in the hospital room. First, speak directly to the attending physician. Ask the doctor responsible for your care point blank, is there a specific medical reason why I cannot be formally admitted as an inpatient? Be candid. We are deeply concerned about post-hospital rehabilitation coverage and out-of-pocket cost. Doctors sometimes default to observation out of routine. Highlighting your concerns forces them to reassess your chart. Second, engage the case manager or social worker. Ask to speak with the hospital's patient advocate, social worker, or case manager immediately. Tell them, we need an inpatient order on record so Medicare will cover necessary skilled nursing care after discharge. Third, request an expedited appeal. Thanks to recent regulations, Medicare beneficiaries now have expanded appeal rights. If you are notified that your status is being kept as observation or changed from inpatient to outpatient, you can request an expedited review through your regional BFCC QIO, Beneficiary and Family Centered Care Quality Improvement Organization. A BFCC QIO is an independent group funded by the federal government to help people with Medicare handle appeals, resolve care complaints, and review medical treatment quality. So let's do a quick recap of the gold rules every senior and caregiver needs to keep in mind. Number 1, ask immediately within hours of arriving in a hospital room. Ask the doctor or head nurse, is this stay classified as inpatient or observation? Number 2, count the midnights. Remember the 2 midnight rule. If care is going to cross 2 midnights, advocate strongly for formal inpatient status. Third, verify before rehab transfer. Never allow a transfer to a skilled nursing facility until hospital case manager confirms in writing that you have 3 consecutive inpatient midnights. Fourth, bring home medications. If you are placed under observation, ask the nursing staff if family members can bring your home medications in their original bottles to avoid exorbitant hospital drug charges. Navigating healthcare and retirement takes vigilance, but knowing these rules gives you the power to protect your health and your hard-earned savings. If this video helped clear up the confusion around hospital stays, please share it with friends, family, or anyone caring for an aging parent. Don't forget to like and subscribe right now so you never miss our weekly guides on Medicare, healthcare rights, and retirement protection. And be sure to grab your copy of the Patient Protection Blueprint using the link in the description or in the pinned comment below for instant access to our hospital stay checklists and scripts. Thank you so much for spending your time with me today. Stay safe, stay informed, and I'll see you in the next video. Blessings.
Download your copy of the Patient Protection Blueprint now. Click the link in the description for your copy.